content over everything.
I'm here with COE. We're at Ladywell Fields, trying to do some interviews here to get people's opinion on the lockdown and various things like that. We managed to speak to, I don't know how many people, maybe about 10 people, something like that. But quite a few of them were didn't want to speak to us, or they were very reluctant, didn't want to be filmed, didn't want to be recorded. And I think that's partially pretty telling. If people are scared to give their opinions about something, that should be the most important thing of public discourse at this time, I would say, considering the effects it's having on everybody's lives. We've got to speak to a couple of people. Some people were questioning why the government isn't saying about some very commonplace medical things that can help boost your immune system, like zinc and vitamin D, things like that. I had some people who are saying they're scared of the virus, they had somebody affected by it, they think it's necessary, they don't know how long the lockdown's going to last for. It's had good effects in one respect. Some people have said they've had the first rest they've ever had in their life or something like that, and they've had more time with their family. Some people are separated from their family though, and they think they can't go and see them. So definitely a mixed bag. Surprising number of people hadn't really thought about the long-term economic effects, because I imagine that's going to have a lot of serious complications as time goes on. But this is our first outing here to try and get the opinions of the public, and maybe we'll have another shot at it, and maybe some other places around here in East London. All right, sound. What do you think about the lockdown so far?
What do you mean? In what context?
Oh, I thought it was a general question. Has it affected you negatively, positively?
It's quite hard mentally. It's difficult, but it's necessary, really, isn't it? I suppose so. Like you can get out and about like this and sort of still, I suppose, get some fresh air and exercise, which is still good. But yeah, it's hard. Yeah,
I see. What about the economic situation? What do you think will be the knock-on effect of this?
Oh, that's a big question. It's going to be hard. Like, there's obviously going to be people, like quite a lot of people unemployed. Like small businesses are going to be like pretty badly, well, already are pretty badly affected.
For sure.
But it'll bounce back over time, I suppose. It depends what the government does.
Okay.
But yeah, they've done all right so far.
All right, I see. Have you come across any alternative information regarding the outbreak?
There's a lot of stuff online. There's a lot of like conspiracy theories, but I think I'm just trying to stay away from it, because it's just like if you get into that, you get into a bit of a dangerous place, I think.
You think so?
Yeah.
Oh, okay. All right, no problem. We'll leave it there. Thanks for your contribution.
No worries.
Thanks. No worries. All right, cool. So what do you think about the lockdown?
It's very free, I think. My country is Lithuania, and in my country we have police on the roads, so we don't have that here.
Not yet, anyway.
It's been a while, I think.
Yeah.
Yeah, so I think we have more we should have more restrictions.
You think so?
Yeah.
Why?
Because people don't obey.
Apply to the situation.
Apply?
Yeah.
I don't know English
I think
words.
the problem is we are suffering at the moment because no one is. I think it's mixed messages with government.
But the thing is, in my country, we had like 10 cases and they shut the country. Here, there was nothing.
No.
Nothing. Oh, you walk in the park, be cautious. But yeah, it was really free, I think. Yeah.
Yeah.
Okay. So have you found any alternative news on the internet about the outbreak? Because there's a lot of different opinions. There's a lot of opinions that are the opposite of the government. I wondered, have you seen any of that?
Yeah, loads.
And you don't think it's legitimate?
I don't know.
I don't know,
what to believe.
because I
don't know what to believe.
I work 24/7, so because
I'm at home.
I work on OpenReach, so I'm.
You can't see it.
No, I can't see it because fibre nectic. Shit, it's inbound. I don't know. I really don't know. It's hard going at the moment. Yeah.
No, I'm always on the internet and I don't know what to believe.
Okay. Yeah. Now that's definitely fair. There's a lot of contradictory information.
I don't know. There is so much.
What do you believe?
That's a good question. I would say that, well, I mean, my background is actually, I'm a biologist. I've worked as a biologist for 6 years, did my master's in it. So my view is quite the opposite of the government view. So I'm very skeptical about it personally. One of the main reasons is that if there is a dangerous virus, for example, I worked with E. coli. You know this bacteria? I worked with E. coli back at university. And when you're handling this, right, give you really bad food poisoning, or it can kill you, right? You worked in a sealed room, like the room was sealed, just overpressure. You're wearing a full face respirator and a hazmat suit.
Yeah.
I don't see any of that.
No.
So that's a major red flag for me, you know what I mean?
That's how I feel, because I feel like there's contradiction between on.
Contradiction.
Yeah.
Right.
With, I don't understand where we are at the moment, because they say one thing and another, you know, and it feels like I'm insecure at the moment, because
Yeah,
I
you
don't
are.
know where to go.
Right.
I really do not know where to go at the moment. And they're saying, yeah, we're combating this disease, or we're not. I don't
No,
think
we're
we
not.
are. Where do we stand at the moment? I really don't understand.
Well, it's a good question. I'm not sure. There's definitely mixed messages, like you say. So something that another thing I'd like to add is the effect on civil liberties that have happened. Some other countries it's much stronger. Like you said, I have friends in Spain and Italy, and they can't go out their house. I think this is a terrible thing. I don't see the danger.
We're
How do
too
you
free
stand?
here.
How do you stand with other countries at the moment, with compared to us? Where do you feel?
Where do I feel?
Yeah, at the moment with other countries. Do you think we're standing at the moment compared to other countries? Do you think we are at the? I don't know. I don't know. I feel like we're. Where do you think we're standing at the moment?
I don't know, baby.
Yeah.
I don't know.
Oh.
Because some countries have had different effects. You know, Sweden has no lockdown.
Yeah, my sister's I don't know how to call it, family name. So my sister's family lives in Sweden. They had nothing done.
Right.
So they walk freely. They do anything freely.
Right.
And people die in like elderly houses.
Yes.
They just die, and
That's
they
right.
don't research after
yeah.
death.
That's right. Resuscitate.
Yeah.
Yeah.
They don't do that.
No, it's
I know that.
there's a lot of very strange information going around about who it's affecting and how dangerous it really is. Because I've seen a lot of information that says that it's not so dangerous. Like you say, there's contradictory information, and so hopefully we'll get some resolution.
At the moment, what's your information at the moment for other people? What
Okay.
is?
The information that I've found, for example, there's a YouTube channel called London Real. You know this one?
No.
Okay, I recommend you check that out. Yeah, London Real. It's got it's been running for 10 years. It has a lot of, it's like a podcast type of thing. Interviews with people. It's got some recent interviews you should probably check out with highly qualified doctors that come on and they talk about it.
Feedback now with the coronas. What's your feedback?
Feedback?
Obviously, yeah, with other.
Oh, we just started today.
Oh, right.
You're like number 2.
Okay.
Woo-hoo.
I've been speaking to people without the equipment in the park when I've been working out and stuff.
What's the feedback now?
Well, from the people I spoke to, it's only people working out.
Yeah.
I'd say it's 80% of people are skeptical.
Yeah.
Yeah. Well,
Skeptical about what? About the corona?
yes.
There's no
Really?
feedback from the
Yes.
government, Baba.
You kidding?
No, the government has not really elaborated what's going on.
We have to. We have to get.
What do you think
grips.
about what the government's doing at the moment?
Oh, I would say there's a lot of disinformation.
Yeah.
And I'm very concerned with the restrictions on civil liberties. Like I said, the parliament seems to be suspended. They're stopping people from... I was in Hyde Park the other day, and I saw an old man on a bench getting hassled by the police telling him to go home. No, for real. And I saw a mother with young children being told to get out the park or they'll get fined. I had police come up to me and my friends and tell us to leave. And I don't really see the reason. as I say, my background is biology. I know a little bit about viruses, and I'm not convinced about what's going on.
You don't get them infected, right?
It's a lot more... Right, well, that's a good question.
Yeah,
Right?
that's the point. Like, how do we get infected?
Very good, right? So the main way is through mucus and saliva.
Okay.
If you have a virus, it needs to be...
If I'm infected,
Yeah.
how do you...
Okay. You need to be at the right stage. If you have the virus, you're not infectious all the time. You're only infectious for a certain stage. Then you'd have to get a lot of it in somebody else's mouth, and then they'd have to probably have a weaker immune system, and then they might have a negative effect. That's the process. It's not just it's not airborne. It's not airborne.
Okay.
So that's why all this
you
distance
have
Yeah.
is a bit strange.
Right.
But I'm celiac, so I have a weakened immune system.
Right. You
Yeah.
may be at more risk, perhaps.
But I'm not sick.
Well, one of the best things for immune system, from my knowledge, is sunlight, fresh air, and healthy food. So keeping people locked in the houses, it's not good. Anyway, I think we're gonna move on, and we're gonna see what we're gonna do. But thank you very much for the conversation.
Yeah. Thank you.
Thanks, guys. Cheers.
Take care.
What do you think about it overall? The lockdown. How has it affected you?
It's affected me in the sense that I can't see my family at the moment. I speak to my daughter and granddaughter on FaceTime every day, but that's the biggest issue for me, is not seeing my granddaughter. Yeah.
All right, I see. What about the economic aspect of it? Has this negatively affected you, as it has me? I lost both my jobs because of this.
No, it hasn't affected me because I get a work pension, which I live on, so I don't earn. I'm not earning my money at the moment. No, no.
See. Have you come across any alternative information, maybe on the internet, regarding this the coronavirus?
In what sense, alternative information?
I mean, not BBC, Channel 4, Newsnight, these things.
Personally, no, I haven't done. No, but I know some people have done. Yes.
Yeah, right. I see.
Yeah.
What do you think about the social distancing aspect of it?
I think it's absolutely essential.
You do?
We need to do it. Yes.
Well, the interesting thing about that is there's quite a number of professionals that are saying that it's nonsense, and that's a bit interesting. Also, my background is biology. I worked as a biologist for 6 years, and I'm very concerned about the things that are happening in our society, how it's being changed, because covering your face, you can't really communicate with people. Standing apart, you can't really communicate with people.
No, that's right.
And from what I see, they're trying to make it long term. They're spray painting things on the ground. There's signs everywhere.
I mean, your opinion is that it's not necessary, but
No,
there
not
are
at all.
doctors and scientists who are saying it is absolutely necessary. So I'm inclined to believe what they say rather than, with all due respect, I don't know you.
Of
I mean,
course.
if we were to sit and have a chat, maybe I would
Absolutely.
believe you, but I'm just in the hands of the doctors and scientists who are saying wear masks, keep your distance from people. Luckily, I can come out every day and walk the dog, but that's all I can do at the
see.
moment. My daughter gets my shopping for me, leaves it outside the garden gate, so we have no contact at all.
Would you agree that physical contact is essential for human life?
I think, yes, I think I'm actually suffering withdrawal through not being able to cuddle my granddaughter. And yes, we're not designed to be alone and segregated from other people, are we?
That's
We're
right.
designed to be with
Together.
other people. Yeah,
Right.
yeah.
So maybe another question. How long would you be willing to, if this is an appropriate question, how long would you be willing to tolerate this type of lockdown and these type of measures?
Well, as I say, I believe what the doctors and scientists on TV are telling us. So therefore, I would be willing to tolerate it until they say it's safe to do otherwise. I'm not saying I enjoy the situation. I don't like being distanced from people I love, but
Sure.
because I believe them, wrongly or rightly, I'm just kind of in their hands, really. I wouldn't want to tolerate it any longer than necessary.
Right.
But
Okay.
Yeah.
Okay, cool.
Just hope it doesn't take too long.
Yep, that's great. Well, thanks for your opinion.
You're very welcome.
Thank you.
Nice
See you
to
later.
meet you. Nobody on the TV ever mentions zinc,
You should. That's a very good observation.
and they need to.
And
Very
you
important.
should maybe ask why they don't.
Yeah, because they're working on something that a drug company can produce, which will, entitle them to get millions and millions of pounds, whereas a zinc supplement would be would be incredibly cheap in comparison.
Precisely.
Yeah.
Exactly.
But yes, we're taking a zinc supplement now,
good.
both of us, yeah.
That's good. Yeah, and the more sunlight you get, the better.
We're out here every day, so we get plenty of vitamin D. I eat pomegranates every day, so I get plenty of vitamin C. So we're doing our bit.
That's
yeah, we're doing what we can for ourselves, aren't we?
All right.
Yeah.
Well, thanks for that.
Thank you.
Zinc, vitamin D.
Yes, tell everybody. Very important.
Let's make a move. So, what do you think about the lockdown, bro?
It's not easy, but it's necessary, I suppose. Yeah, getting a bit bored of it now, but you gotta stick to it. Otherwise, you're putting people's lives at risk, aren't you?
You think so?
I think so. Yeah. I mean, it's an unprecedented disease, isn't it? So
That's what the mainstream media is saying. That's for sure.
you don't think it is then?
I've encountered a lot of information that contradicts the official line, and that contradiction brings up a lot of questions.
Oh, no, fair enough. I think you're right to question it, but there's no smoke without fire, innit? It's got thousands of deaths all around the world.
So they say.
So they say.
There's
All right.
Well, recently there's been a doctor in the USA that came out in the media that exposed that they were getting everybody who died and marking it down as corona. And there's a lot of...
What, you think it's being over-reported then?
It could be a variety of things. It could be over-reported. It could be completely made up. Who knows? But there's a lot of messed up information.
No, I don't disagree that there's some perhaps inaccurate or incomplete information, but I'm trying to stay the 2 meters, man. Just being.
It's all speculation.
No, but yeah, I think it's. I don't think it's a complete hoax. I think that's yeah.
Well, one thing you can do when obviously, I would highly recommend to look up alternative sources for everything. Sure. just for everything in general. One of the things that I would like to ask is, how long would you be willing to tolerate this type of restriction upon your civil liberties?
It's a difficult question. I don't think any of us thought it was going to last even this long, really. But yeah, just take it one day at a time, really. I don't want to put an indefinite time frame on it, but yeah.
See, well, I want to ask about economics, but of course it's a personal question. But I lost both my jobs because of this, so my economic impact has been very negative. Has it affected you or your friends?
Well, me not so much. I work in the telecoms industry, so it's an industry which, ironically, is doing quite well out of this.
Right.
But some of these guys are actors, musicians, and stuff, and self-employed, and it's really hit them hard because obviously where the next paycheck's coming from.
Right.
So yeah, economically, it's hard for a lot of people.
What do you think the long-term effect of this will be? Because when somebody loses their income, they lose their financial security. It's extremely stressful, as I can testament.
Yeah, as I've witnessed with my own eyes throughout the last few weeks with my friends. Yeah, I think the economic impact is going to be tough for a while. We're going to be feeling it for a while. I think it's how we react to this could essentially be how we shape the future of our species.
Right.
I think we need to come together in times like this, rather than try and stay selfish. And I hope sort of to build on that we learn some environmental lessons from this, and that we realise that we can live with less, and that there are things that are more important than
rampant consumerism, for example.
Yeah.
I see where you're coming from.
Okay.
All right, it's cool. Another thing to say, let's see. What do you think about the social distancing, like this whole thing here? Because something before I begin, like people wearing masks, like covers their face. It's difficult to get that interaction. You don't see people's.
Totally. I think that's one thing which
which I think we've all been really missing, is that. You know, you don't smile at people in the same way as you did a couple of months ago.
People are suspicious of each other.
Yeah, so I hope that's something which changes. But yeah. Anyway, I'm going to join my friends and thanks football.
No problem.
Enjoy the rest of your interviews and enjoy the nice day, guys.
That's it. Thank you. Cheers. Sound. You're seeing the effect in that. Is it? What do you think about it?
Well, I think, me personally, I reckon they should have a proper lockdown here.
Yeah.
Well, everywhere, because as you can see, when the sun's out, everyone's out. As I say, they need to be in the hospital to see the people on the wards, the state they're in, that they might think again about coming out.
Right.
I know it's horrible being stuck indoors. You know what I mean? I miss my family and all that, but can't say I ain't seen my mum for about 6 weeks now.
Right.
Or the rest of my family, not even my friends and things like that. So yeah, but I said the quicker people realise what is happening, the quicker this will be over. But as it says, you go everywhere, no one's standing, everyone's walking close together, everyone's queuing up together in outside shops and things like that. So really, it's to me personally, I think sometimes why am I risking my life out? Like to be out there. We've lost drivers already.
Yeah.
We lost about 5 drivers last month.
You mean dead?
Yeah, through COVID.
Really?
Yeah, because this is what we do. So that's how bad it is.
Where would I be able to get confirmation of that?
Well, this is from other companies. We lost a couple in Kings for another company we work for. We've lost, from my old company, we've lost a couple and all that. We lost one about 2 weeks ago on a Sunday. So, but as I said, it is bad.
All right.
I know some places have eased down a bit.
Yeah.
But as I said, you need to be in the hospital, in the wards, to see what it's like, really like.
Okay. What about the people generally affected? Is it mostly old people, or is it a selection? What's it like?
It's a selection, more old people, more like Africans, Indians, and all that. There's been a few ones we've taken. We've taken a couple down to kids. We've taken down to St Thomas's Hospital,
right,
and all that. But yeah, mostly it's just mostly the olds.
Right, I see.
But we've had some good news. We have taken one. She was young. She went in for an operation, ended up catching it.
Right.
And she did get cleared and everything, and she was over the moon. So there is good ones coming out and things like that.
Well, that's good to hear, yeah. Because it's something that I've found a bit strange, and some other people were saying to me that's really, really strange, is why the government is not publishing the records of people who have recovered.
That is true as well. It is, because there is a lot of people out there, and as I said, they've not worried about the good ones who got through it, you know what I mean? But as I said, working here, you see it firsthand.
Yeah.
You can see how tired the nurses are, the strain it's putting on us, as I said, because half the time they ain't got the proper stuff and things like that.
Right, yeah.
And sometimes it's getting, I mean, to me, it's tearful, you know what I mean? It's hard in here to see the state of people fighting for their lives and all that kind of thing. Just got in here to have one thing and end up catching the COVID-19 and end up dying.
So I suppose a couple more, if you've got time, man, a couple more questions. From other people that I've spoke to as well, they were wondering, I don't know if it's this hospital, I don't know which hospital, but seeing that a lot of the areas of the hospital are empty, and people doing dances and shit like that. It doesn't seem like a catastrophe if that's happening, you know?
They're celebrating because people have got over it and come out of the hospital.
All right.
But yeah, some hospitals, the wards are empty, but all they're doing, they're emptying the wards for the next batch to come in. And that's what's going to happen, because as you see, more and more people are still out there, not staying indoors, so that's why they've emptied wards ready for the next batch to come in.
Okay.
And you will get that.
How many cases are you getting per day, on average, roughly, do you think, in this hospital?
Because we're not really based down here. Where the touchwood, the ones we've taken out today have been negative.
Okay.
They've been positive, but they're cleared as negative now, so we've taken them home and all that kind of thing. But I said, down like Kings, where I normally work during the week, you can see them coming in quite a lot.
All right.
Down there. Cool. But I said, all hospitals are different. Like at the weekends, we're normally down like Maidstone and all them hospitals, what are quite bad, very bad down there. St Thomas's is another bad hospital. I mean, you can see them coming out by the drones down there.
All right, I see. Is there anything, because I was speaking to some people in the park just around there, and some people, there was a woman who worked, I don't know what she did. She was working as a chemist or something like that for a long time, and she said that people taking zinc and getting vitamin D and stuff will help boost their immune system. No?
I wouldn't say so, no.
No?
But they should know better than me, but no, I wouldn't say so.
All right. All right, cool. I think that's it, eh? It's good, man. Thanks for talking to us, eh?
All right,
Appreciate
thank
it.
you.
Cheers.